Hi, I'm Andy Van Kleunen. I'm Executive Director of the National Skills Coalition, and I'm here today participating in a Washington Fly-In that's been organized by Business Leaders United for Workforce Partnerships, an employer-led organization that has brought together a range of companies from throughout the country who are concerned about the skills gaps issues facing their industries and have been working with local partnerships in order to solve that problem for their companies and for their local economies. And I'm joined here this afternoon by 4 of the employers who are participating in this fly-in today. I just want to introduce them and give them a chance to talk about what they've been doing with their companies and their local partnerships. So all the way over there, Scott Ellsworth, who's the Vice President of U.S. Operations for Tipco Punch, a small manufacturer located just outside of Cincinnati, Ohio. Next to Scott is Charlene White. So Charlene's the Senior Human Resources Manager for The Gap, an organization, a company that we've all heard of. Charlene's based out of Houston, Texas, right? Next to Charlene is Sam Bottum. So Sam is the General Manager of Innovation Works for SnapOn Tools, a national manufacturer that we all have heard of. Sam's based out of Kenosha, Wisconsin. And next to Sam is Lynn Pecora. Lynn's the Director of Training and Development at Inglis, which is a center for people living with disabilities in Philadelphia, Pennsylvania. So, Scott, let me start with you. Tipco Punch, small manufacturer, you run the operation there. Why is it that you have been so focused on these workforce issues? What are the challenges that have been facing your company and what you've been trying to do about it?
Well, Andy, Tipco is a manufacturer of 30, an employer of 30 folks. And really, typically you wouldn't find a small manufacturer getting this involved in workforce development issues. But for us, we've had a hard time finding folks. And this started probably 7 years ago. And what I've realized is that in my involvement, although The Gap and SnapOn, you guys get a lot of attention, small companies, we don't get much attention at all. And so there's not, unless we kind of band together and we get together and we start talking to our training providers and the other folks who are involved in workforce development, if we're not doing that together, then what happens is that really the folks that are getting trained are no better set up than they were before. And so we're not able to get those skilled employees because we're not telling the training providers what we need.
So how did you start to deal with that there in your industry?
Really, it was 7 years ago, 8 of us that were manufacturers, all small like us. Actually, we were probably the smallest there as well. We got together and tried to put together some training and all of that. And then we found that there was a public-private partnership out of Cincinnati that really is regional. So they're doing northern Kentucky, southwestern Pennsylvania, and then southeastern Indiana. And it was a partnership amongst all of those regions as well as amongst manufacturers. So although some of us are somewhat competitors, within that partnership what happens is that everybody is working together to kind of raise the bar in the entire region. So if there are more employees available for me, there are more employees available for all of the other individuals that are involved in it. So it makes a huge difference for us.
And this organization, this is the Partners for a Competitive Workforce out of Cincinnati, right?
It is.
And what are the range of organizations that are participating in that partner group?
We go from very large employers, GE Aviation is a part of it, all the way down to ourselves, which at 30 people, we're one of the smaller employers, American Fan. There's a number of others there that are very small, but we've probably got about 50 employers, manufacturing employers involved. And then there's also an IT career pathway, there's a healthcare collaborative career pathway, and finally there's a construction collaborative. So what we've got is 4 key sectors that are working on their own issues, but we have a lot of similarities from one to the other.
Great. So Sam, SnapOn is a larger manufacturer, a national manufacturer. What are the kind of workforce issues that you've been dealing with throughout the SnapOn Corporation, and are they similar or different than what Scott's been dealing with at Tipco Punch?
Very similar issues, Andy, and really our issues run the gamut from not just trying to hire skilled workers ourselves for our own manufacturing processes and whatnot, but also the customers we serve. We work with really large companies to very small companies as well, individual automotive shops, for example. And hiring skilled workers is critical across all those kind of companies and shops, so very important.
So what is it that you've been able to do to try to develop how it is that you're going to find those skilled workers or develop those skilled workers? What are some of the things that SnapOn has done?
We've done a number of different things. For us, we work very closely with community colleges across the country and developed a number of local partnerships of different kinds. We've gotten very involved with certification processes and work with NC3, National Coalition of Certification Centers, to accomplish that. We've also taken a number of initiatives ourselves. So for example, in Murphy, North Carolina, in the western part of the state, is an area where there were a number of apparel manufacturers that closed down. We were involved with partnering with the Tri-County Community College there in developing the workforce to change our manufacturing operation there from an assembly operation to actual manufacturing and all the higher level skills that are required to do that.
So, and what kind of, like, how did that change in terms of the skill demands for the workers that were required in that plant that switched over from assembly to manufacturing?
It really, it sounds simple, but they aren't given a lot of times for workers depending on what they've been doing before. But for example, the ability to read blueprints would be one example. Your knowledge of geometry and being able to cut angles and whatever the case might be, to run CNC machines and whatever the case might be. So a whole slew of skills that were critical that we needed from the local workforce in order to have our plant operating optimally. And I will point out that actually the plant was recognized in 2010 as one of the top 10 plants in the country by Industry Week.
That's great. So clearly SnapOn is dealing with its own skill needs. The fact that you've been working with these local colleges and other training providers, has that had any multiplier effects for other manufacturers where your companies are located?
I think so. I mean, clearly investment in the community colleges and in the local workforce, I think as Scott was saying earlier, pays dividends for everybody, locally, but also hopefully more broadly as well.
Well, and Andy, I heard Sam say something though that really kind of lightens my heart, and that is that you said that you're helping some of your customers. Now, as a tool manufacturer, you've got a lot of customers who are manufacturers as well, I'm sure. But the fact that you're reaching down to smaller employers and helping them to get a better workforce is incredible. Because usually the small employer's fear is that the big guy is going to steal all of our good people. And so to have you actually saying you're helping those folks is great. I love that. And that means that we're in this together.
Well, I think the future health of our business and our industry relies on customers like yourself and others. I was just in some independent aftermarket automotive shops out in the Denver area last week, and a number of great shops doing great work, but their growth is inhibited by the fact they cannot find local talent to work as automotive technicians. That really satisfied the needs they had. They had the skills that they needed to operate with the standards they wanted. And so you see it every day, whether it's small or large, industries and companies getting held back.
So you can't sell tools if there aren't folks with the right skills to use them on the ground in some of those auto shops.
Mm-hmm.
So we need to be looking across the industry and across a bunch of different types of firms to kind of solve that problem. Excellent. So Lynn, let's go. Let's move from manufacturing to healthcare. Yes. So why don't you talk a little bit about what Inglis does? It's a very well-regarded center. I know both for clients and for folks who work there who really hold up the work that you do. Tell a little bit about it.
Absolutely. We're a 136-year-old organization, and you don't get to be around for 136 years without doing something right. We service the disabled. We do have a niche, if you will, in the community because the oldest or the average age actually of someone living there is 50, which is very non-traditional for a nursing home. We also provide services and employ the disabled. Our glitch, I guess, also is keeping our first-year certified nursing assistants with us longer. Right now, our turnover rate is probably at 20%. I would say 2 years ago, we were at a really bad spot. It was at 69%, and we were at a loss of how we were going to handle this. And we happened to be working at the time with the Greater Philadelphia Healthcare Partnership, which is facilitated with Susan Thomas from 1199C. And we put our heads together and said, well, you know, she said, Lynn, what do you need as an employer? I said, well, we need for these folks to have X, Y, and Z skills, and we're not getting that. Okay, what can we do to change that? Well, you know, maybe we could actually look at hiring these folks through the partnership. We can establish the competencies that we need, recognize them, draw them out, take these folks through the training from that end. We had them actually go through the state certification program. Once they passed that, we then said we want them to have an additional 32 more hours of training. In what areas, right? So I'm really partnering with Susan,
Right.
and she's asking me, and this is all very meaningful. Well, we want them to have customer service, really good communication skills. Okay, we're going to put together a 4-hour class around that. Documentation. They need to be able to document so folks can see what's going on every day. Workforce readiness, huge thing, right? You would think someone's going for a certification that they know how to approach customers. Not necessarily the case. Showing up for time, huge thing. Another 4-hour program or so. So we had great success with this. We were able to hire our own, grow our own, as we like to say. And we actually, at this point, other folks where Susan and I have went to present are asking about it. How did you go about doing it? How many people did you actually interview? How many people are still working there? So this is certainly, as small as that program may seem to, you know, any of you sitting here, it was huge to us. Now, of course, we added other things that we needed to change, how we interviewed. We started an assessment center, and that's, you know, another day's conversation. But partnering with the healthcare partnership and 1199C, I mean, this just really was phenomenal for us. And
So, and talk a little bit more about this partnership, because obviously Inglis is one of the
We're
companies
one,
or the institutions that are participating, but there are other healthcare institutions that are participating as
there,
well.
I think there's a total, I'm sorry for interrupting you, I think there's a total of 60 employers with this partnership in Greater Philadelphia and 14 educational institutions. The other thing that I really benefit from it as an employer is that there are quarterly meetings that we have where we invite local politicians, we invite folks who have skills and training and conflict resolution, and we have community college come on board. You know, we just had our partnership meeting this past Thursday, and we had one of the councilwomen, Blondell Reynolds Brown, come, and she presented, and we had the opportunity to learn a little bit more about the demographics of the educational level of someone living in Philadelphia. And as she started to share with us, 69% of Philadelphians residents do not have college degrees. 17% do not have high school diplomas. I immediately, as an employer, started to think about our, if you will, profile of our average employee, who is an African American in her 40s, head of the household, making about $35,000 a year and having 4 dependents. That's, you know, that's a lot of responsibility. And they give the most intimate care of these folks. I mean, ADLs, activities of daily living, they're washing people, they're bathing them, they're moving them. We need help with that as an employer.
It's a highly skilled job.
Highly skilled
and
job.
that's why if folks don't know what they're doing, that's how you have high turnover.
Absolutely.
Yeah. So obviously working in this partnership has worked well for Inglis, and it sounds like it's working well for other healthcare employers in the Philadelphia region as well.
It's a win-win.
That's great. Thanks.
Sure.
So Charlene, so a lot of us know about the Gap. A lot of us probably shop at the Gap, but I don't think we would ever thought that the Gap has a workforce issue or that needs to have a workforce strategy. So what are you working on there in your company?
It's interesting. We actually, the Gap was founded in 1969 by Don and Doris Fisher. And their mission at the time was really to be America's favorite American style. And when the other mission, the kind of shared mission really is to do more than sell clothes. It's really to give back to the community. So a couple of years ago, when we had the opportunity to get involved and start with Skills for America's Future, we said, wow, what an opportunity, what can we do with this? We went out and we started looking at our workforce saying, what skill gaps are there? Why can't we hire 100, where we don't hire, we actually are a company of 136,000 employees. So where can we get these people and what is it that they need to have? And we started looking around and really ran into a lot of the same issues. It's the communication skills, it's coming in for the interview, it's being prepared, it's having a great resume, talking about transferable skills. It's time management. 80% of the community college students also work as well as have families and really are really busy. So it's time management, making sure that they can perform once they get the jobs. So we looked at that. We have all the in-house training, right, because we train our managers. So we took that and we took it to the community college students. And that's really been a very big success.
So you're working with the community colleges, so maybe talk a little bit more about what is it that exactly you're doing with those colleges?
Well, you know, one of the things that I found to be most successful is actually keeping it organic. So each school being very different. We go in and we assess and we talk with the school, the faculty, the staff there, the professors. What is it that your students, here's what we have to offer. And again, last year we started, or 3 years ago, we started with just 7 markets. We're now at 25 different community colleges across the U.S. in 18 different states. And one of the things that has been so successful is actually getting them prepared for the interviews. However, the faculty and staff came back and said, hey, since you have all these training programs, is there any way you could help us do a little bit more? How about conflict resolution? How about problem solving? How about agility? So we've started really developing a curriculum outside of just those things that we found were necessary into what now has been identified from other industries as skill sets that they want, and so we're helping them. On the 25 campuses, 50% actually has synergy, so with fashion, retail, merchandising. We also have 50% of our schools that we're partnering with that are nurses, healthcare, and all other industries. And I think that that's kind of the other part of what's made this program successful. We didn't initially go in and say we want everybody to be in retail, right? We wanted to go in and say we want you to get a job. We want you to get the job you're passionate about. Not necessarily, it doesn't have to be with us. It's about whatever makes you passionate, but we're going to set you up for success. So that's really what's made it successful.
Well, so obviously you're run very different, or you are running HR for very different companies, from smaller employers to one that's employing over 130,000 folks across a range of different industries. So one of the things about Business Leaders United for Workforce Partnerships was to see whether or not there was something in common across a range of employers, a range of companies that are trying to deal with these workforce issues. So Scott, since you've played a leading role in kind of bringing BLU together, I mean, what was it the inspiration for you and others to create this kind of an organization?
Well, the 4 founding organizations that put it together, really I think we're looking for a voice across the spectrum. Mm-hmm. And I think that's what you're hearing up here is that we've got voices from very, very small to very, very large companies, and we're having the same problems. And so without kind of pulling all of that together, nobody is speaking for that here in Washington, D.C. Frequently what you've got is that when the administration or Congress or somebody wants to get an opinion, they'll go to the head of GE, Jeff Immelt. And the problem is he's not really connected to workforce, like even down to the Gap, they've got folks who are connected to workforce. We're bringing in the people who really know what the issues are and who can really speak to those issues so that when we talk to Congress, we talk to the White House, we talk to the folks in the Senate, we're able to tell them, here's where the rubber meets the road, here are the real problems that we're having, here are the ways that we're trying to resolve it, and these are things that we think you could be supportive of here in Washington, D.C.
Now, I mentioned that we're here as a 2-day meeting, and so I know that some of you were just participating in some smaller discussions between different employers from a range of different companies. What were the things that you were hearing from those discussions in terms of like areas where there were commonality or things where you thought you could learn something from another employer, whether it was from your industry or from a different one?
I just one thing that came up at a higher level was just the notion of elevating, honoring, recognizing these kind of professionally skilled jobs in a way that they're not right now in this country. There's an opportunity to really celebrate the dignity of the work that people do in all these different industries in a way that today often it's viewed as a consolation prize. And I think one of the opportunities for us, and part of what we talked about in our small group discussion, was that sort of taking it to a higher plane and elevating it the discussion.
So those kind of technically skilled jobs, maybe they require a college degree, maybe they don't, but there is something that there's a job out there, there's a set of jobs out there, and we should be focusing on making it easier for more people to move towards those jobs, working with employers like yourselves to figure out how to do that.
And Andy, being exposed to them, I think that was one of the things, Charlene, that the group that we were in, just the fact that they don't realize there's so many jobs in manufacturing. It's just not one or two, and the same thing with healthcare. You know, you just don't have to become a doctor or a nurse. You could be therapists, you could be medical technicians. I mean, there's just such a magnitude of other things out there, and it's, you know, who's responsible to get that message out, you know, and when do you start getting it out? That was the other discussion. Does it start in middle school? Does it start, you know, at third grade when kids start, you know, asking about things? When's the right time?
Have you ever found that you've had a conversation with maybe, I don't know whether it's could be a federal policymaker, could be somebody locally, but this idea of these middle skilled jobs, I mean, is that something that is news to them in terms of how important some of those are to how your company runs, or?
I don't know that it's a new. I think it goes back to marketing, what the opportunities are, advocating for the industries. I think that's where there seems to be the gap. Really, is those jobs and advocating for them.
Anyone else have a thought on that? If there's some experience that you've had, so here I know that you all are going to be having conversations in D.C. here tonight and then tomorrow with, as Scott said, members of the administration and folks up on Capitol Hill and Congress. If there was like one experience that you've had that you think could really kind of change or inform their thinking on this issue of skills and the skills gap and the challenges that your companies are facing, what one thing would you want to kind of share with them over the next 24 hours?
I think that the skill level for everyone is changing, whether you're in healthcare or manufacturing industry, and we need to constantly be aware of that. Public policy-wise, employer-wise, family-wise, whether you have children, you do, everything's changing, and it's up to all of us to make sure people are aware of what's going on and to foresee some of those skill levels and do something about it. You know, it's, you know, healthcare, we're going to definitely be looking at a whole different set of skill level. You know, with ACA coming on board, less and less physicians will be available, more is going to be put on the RN, the LPN, which then will trickle down to the certified nursing assistant, who is going to need a set of clinical skills that are way more involved than they've ever been. And we need to adjust for that and be ready for it and be ready to train them and make sure they're comfortable being trained and support them.
But does that necessarily mean, though, that 69% of people in Philadelphia who don't have college degrees, they have to have college degrees?
Absolutely not. I think there's job opportunities for everyone out there at different levels. There are I think there's certification courses that could be offered, and redesigning of some of the opportunities that are out there through the college level, whether it's community college, but it's looking at things differently and making adjustments and modifications where you need to.
And that's good news, because policymakers are finally now starting to understand that college is not the right answer for everybody.
Not everyone, absolutely not.
And that post-secondary means a lot more than college.
Absolutely.
Certifications, etc.
And we need people at every level to do everything, right?
Right.
I think, I mean, part of what I'm hearing is it's about having skills that are practical, that are relevant.
Portable.
Yeah.
Portable and clearly, portable, transferable,
Absolutely.
stackable, any number of other ways that you can look at it, but they need to be relevant to obviously the industries we're talking about.
And I know in manufacturing this is a particular issue, right, in terms of the types of credentials that folks are earning. Are there things that we could be doing in terms of national policy to make it easier for folks to know what it is, what kind of certifications they should be looking for if they want to get a job, whether in manufacturing or one of your industries?
I don't know from my perspective that we want the government telling us which certifications are the best. I don't know how anybody else feels about that.
In our smaller group, we had a discussion. The healthcare industry, I think, would like that kind of sort of.
But
Scope of practice.
Okay, but I do think that what we do feel like is that the government could certainly be far more supportive of post-secondary certifications.
Absolutely.
Could help to maybe drive some of the portability. I think so frequently states like to have, this is our state's thing that's not portable across state lines. As manufacturers, I want to know what they know. So when somebody comes to me with a certificate, I want to know that it matters, not just to SnapOn, but to me. And I think that it's really great now that you're starting to see I'm not worried about SnapOn poaching my people. Even if they were in the same town with me, if I get better people, it's good for them, and if they help me to get better people, it's good for them. And you know, all the way up the food chain and all the way down the food chain it's critical.
So we often talk. I'm sorry. Go ahead, Charlene.
No, I was just going to say I think that's a great point. I think what we also want to make sure they see is that we're collaborating, right, from an industry, from an employer perspective. Anything they can do to help alleviate or navigate through the complexity, that's what we need.
Or maybe they could collaborate.
Yeah, or they can.
Wow.
Yeah, but to help us, because we're all collaborating.
Right.
It's the competition really in this point is gone. We're here to do the same thing, put people to work.
Right.
But sometimes those partnerships don't happen all by themselves, right? I mean,
Absolutely.
there does seem to be a role that policy could be playing to make it easier to bring employers together, even just at the local or the regional level, to kind of figure out what is it that you're looking for in terms of skills, what it is that you're looking for in terms of certifications. Do you think that policymakers understand that there is a role without telling you what to do, but to create the ability to get more employers to the table to figure some of that stuff out, like the Greater Philadelphia Healthcare Partnership?
I'm not sure if they do understand. You know, I rely on the partnership to help me, walk me through things, and for me to understand. I mean, they're viable in that role. You know, and I'm very fortunate, I believe, to have the partnership that we have, and the person that I'm working with so closely in 1199C. I mean, we have a great relationship, and you know, I just pick up the phone and, you know, I can ask her something and she's there as a personal resource. Let me help you. You know, what do you need? You know, when we need the policymakers to understand that these things are happening, as you're saying, Charlene, it's collaborative. You know, we rely on that to happen.
Well, to take that a step further, policy doesn't necessarily mean that you have to dictate this is the way that it's got to be. I know that as we talk to the folks who are around the rooms today, you'll find that in some cases the WIB is the convening group, sometimes it's the United Way, sometimes it's a community foundation, sometimes it's a group of employers, and policy doesn't support that today. Policy kind of says this is the only way that you can get that money, and it's got to come this direction. It needs to be a little more flexible, and it's got to be supportive of how it works, where it works.
So the partnership element is important, but kind of who's playing the lead, that really is something that you'd like to have folks on the ground kind of figure out based on what's going on with the industry or the collection of actors and things like that. And it is true, I mean, I do know a little bit about the history of the Philadelphia partnership. I mean, that was started with some federal resources and some state resources, both of which now are no longer available. So the partnership is kind of keeping on, but you know, its ability to expand is somewhat limited now by the fact that those resources that had helped create that partnership are no longer available. Any other experiences that you think folks here in DC should hear just based on what you've been doing on the ground in any of your companies?
I would say, you know, we worked with the Skills for America's Future group and the Aspen Institute. They have been a tremendous resource for me, I know, and for the other companies. And the more that we get together, the more that we share success stories, the more that we share challenges, we seem to work through those together and really make it a lot stronger program. And I anticipate that the program will continue to grow. And it's like now colleges are coming to us saying, please come and do this for us. And can you build out your curriculum to include more of these skills because we need them in this industry. So we're actually getting the request now. So I think that I can speak for the Aspen Institute has been a tremendous help for us.
I'd echo that too. I think we've been involved with Skills for America's Future as well in the Aspen Institute. And we found that opportunity to sort of amplify existing success models, learn from them, and really and sort of advance just the successes that people have had in really practical ways on the ground is very helpful.
And I know, Scott, because Partners for a Competitive Workforce in Cincinnati is affiliated with the National Fund for Workforce Solutions, so also an example where you have different folks in different cities who are building these partnerships and then have an opportunity to learn from each other about some
Right, it's been crucial to us, that funding, and it doesn't come from the same source of funding that they have, but again, it's that flexibility that's really critical.
Excellent. Well, thank you. I appreciate everything that you've shared with us today, and we'll let you get back to the rest of the meetings, and looking forward to further discussion.
Thank you.
Thanks, Andy.
Thanks, Andy.